Hi.
Hello.
Hi. How are you?
I'm good. I'm glad we're finally doing this.
I know it's great. So, so where should we start from?
Oh my word. I have a long list of questions because this is so important. So I tried to categorize them as best as I could from the major ones that I got. And I'm sure we won't have time to get to everything, but that just means we have to talk about it again. So I think we have so many people, and I know I'm interested in talking about perimenopause into menopause, which is, obviously your specialty. I think one of the biggest questions that came up was, what about hormone replacement therapy in perimenopause, and what are some signs to be on the lookout for?
Yes. Perimenopause is just a transition phase, something that is a big gap in knowledge. I mean, even medical doctors never trained. I wasn't trained in my university those days about perimenopause. So it's something more newer, I would say. And so it's a transition. It's a phase which may last for years, 10, even 15 years before menopause. And that's just fluctuations of sex hormones, estrogen and progesterone, declining those hormones up and down, as well as testosterone in some cases. And of course, it comes with so many different symptoms. In women, we see all sorts of symptoms. Some women not feel any changes in their body. Some women start feeling um, ups and downs, stronger PMS symptoms, mood swings, weight gain, sleep problems, hot flashes, simply just having heavier periods and bleedings, or the cycles may skip a cycle or having shorter cycles. So many different symptoms. So you wanted to know about hormone replacement therapy during this time.
Yeah, so I think the confusion for a lot of people is, when do they start considering it? What can they do to support this up and down as they're going through anything from a 10 to 15-year time frame until actual menopause sets in, that ceasing of those fluctuations.
Mm-hmm. So the most important thing, what I'm doing on my platform day and night, educating women with the most recent evidence-based information. So just very important to, first of all, educate yourself and be able to be advocate for yourself, the CEO of your bodies. Go and talk to your doctor about those changes. So that's the first thing you want to do, just to talk and have that shared decision with your doctor about all those symptoms. And then you want to go through some tests for sure that I will let you know later. But so that's very important to talk about it. I mean, I keep hearing some people say menopause is natural. Of course, living is natural. What it happens 100, 200 years ago, women used to die from simple things like giving birth, infections, or acute abdomen. Now women live long for many, many years, up to their 80s, 90s. So the quality of life is so important, to not have that osteoporotic fracture, mental health issues, and so many other problems that hormone replacement therapy can prevent. But so menopause, the definition of menopause is just simply 12 months not having cycle, but that those symptoms of perimenopause may even go after menopause and last for many years after menopause, hot flashes, for example. So that hormone replacement therapy can start before menopause. It's nothing to do with that arbitrary definition of not having period for 12 months.
Yeah, I love that. I think that can be really confusing for some women. And I know, especially specific to the pelvic floor and how you and I would relate or share common concerns with patients, is that increase in incontinence that can happen from those fluctuations, which many women see cyclically before they even enter into that perimenopause. And how can we support them through those changes, again, for quality of life, so they can still stay active and strong, especially when those symptoms start to kind of hinder their ability to be active as well as maintain that quality of life. So that is something that has come up a lot. And I know that the decline in estrogen can decrease our muscular strength.
Mhm.
Sometimes just adding that in can make a difference, but it's also the ability to generate that strength through that decline in estrogen too. So I feel like it is putting together both of our disciplines to give them the absolute best result in that respect.
100%. I totally agree. It's so important. As a functional doctor, as a holistic doctor, I definitely encourage everyone to work on their lifestyle all the time. So it's not just all about hormone treatment, prescribing hormone, and there you go, off you go, and that's it. No, this is just the beginning. You want to work on your lifestyle and optimize hormones and everything, because we not just see the shift in sex hormone, estrogen, progesterone, and testosterone during this time, but insulin, thyroid, cortisol, so many other changes. So we want to address that not only with hormones, but with lifestyle adjustments. That is very important.
Well, I think it's with anything that you would do in life. It's not just one thing. It's
Mm-hmm.
how can we layer everything on? And I think there's so much talk about hormone replacement, which I think is absolutely fantastic. But I do think it's important to continue to echo that message of it's not just that, though. We still need to be doing
Mm-hmm.
everything else. And so I'm curious what your thoughts are and how you approach this topic, because one of the very common questions I receive from people in my community was about that stubborn lower belly and what can they do to address that? Do they need to be on hormones? What do you tell somebody who is coming to you with that question?
So hormones, hormone therapy with estrogen and progesterone or testosterone is not for prevention of or treating fat and weight gain problems during this time, for sure. So that is not, hormones not FDA approved for treating weight gain and or helping with weight loss. So that's the first important thing. But that stubborn belly fat, which I myself experienced that during this time, and many of my patients and other women's have this issue. So this again mainly is due to decline in estrogen. So that caused that body fat shift around the waist, body composition change, and not only that estrogen decline, but as I said, insulin resistance we see more in women during perimenopause and menopause. Again, very stressful time, so high levels of cortisol, that doesn't help. Sleep problem. Again, very important, muscle loss, sarcopenia. It's very common. It starts from 30s and 40s and it continues. So each year we lose some muscle. So that's again losing muscle, lower metabolism, more fat, lower metabolism. So these are all factors involved in that stubborn belly fat.
Yeah, it's an excellent, it's not just ever one thing,
Yeah.
right? But I think when you understand the mechanisms of the why, then you feel more empowered on what should you be doing, which I think you pointed to are a lot of the things that are nutrition based, stress control,
Mhm.
as well as creating that muscle and working as hard as we can to maintain it, even though those physiological factors are kind of pushing back and we can only have so much control over that.
Mhm. So definitely you want to work on weightlifting. So some sort of exercise. So walking is great, some cardio, but we want to work on building up those muscles by lifting, by resistance training. That's very important. So you want to include that in your workout routinely. And then protein is important to, we, especially women, don't take that much protein, but it is recommended to have 1 gram per kg of your desired body weight of protein, which is not an easy thing. I've tried and it's very difficult. I recently started having some bone broth and creatine, and of course I do take some protein bar or powder, which is not ideal. It is still processed, and we always say to avoid processed food, but it's hard to get that much protein in diet. But if you manage, great, do it. If not, you can add some supplementing and some protein bars. So these are important. So work on your sleep. So prioritize your sleep. You are not in your 20s, so definitely your body has changed. So you can't have parties, late nights. So definitely that affects and impacts your body and your hormones. So you want to prioritize 7 to 8 hours of good night's sleep, solid sleep, which is a big problem. I see many women complain about sleep problems. They wake up with hot flashes, night sweats, or just simply wake up with sugar crash. So that's why that bone broth helped me at night before I go to bed. It definitely is soothing, and it helps with high levels of protein. And same time is low calories. So sleep, and then exercise, diet, lots of antioxidants, anti-inflammatory diet. Cruciferous vegetables are great for breakdown, especially of your hormones. They're amazing, so definitely take that daily. And water is great, so you want to keep yourself hydrated. That is a very important fact for detoxification too. Not only helps with your weight loss, but detox. So these are my recommendations about optimization of your hormones naturally.
Okay, I love it. Yeah, you covered that because I had that question come up a bunch of how can I set myself up for entering
Mm-hmm.
perimenopause? Well, how can I optimize? But what I love about everything you just said is they are very accessible suggestions for most people to make a change and try to incorporate these things to foster better sleep, which helps with our hormone health,
Mm-hmm.
and then is going to give us that energy to create those better healthy habits. And I think where I resonate with you is my emphasis on strength training, and especially with the population and my specific niche is, well, how do we strength train if we have these existing pelvic floor issues? And for so long, like you said, women have been told to stay away from certain activities, especially if you have a pelvic floor issue, shouldn't be lifting heavy, these kind of just very outdated suggestions. And so that's where I like to come in and say, it's just how we do it. And I want to teach you a better way because all of the things that you have echoed for hormone health with aging can be under our control in some effect
Mm-hmm.
with our actionable things like strength training and protein and eating well. And so it's just finding the right way so that women can continue toward that aging process, feeling well and having a good quality of life instead of just sitting on the sidelines because they are worried they're going to leak, embarrassed of leaking, thinking they're going to make their prolapse worse. And all along, what that has done is just encourage less and less activity,
Mm-hmm.
less creation of strength, and kind of more perpetuation of those issues with age, right?
Yes, definitely. I mean, myself going through a twin pregnancy, definitely I had, after my delivery for at least a year or two, I had issues with pelvic floor and stress incontinence. So it's very common. So it's not only going through perimenopause, but through the pregnancy. I think that's, again, your niche and your expertise.
Right. Well, and that's it, but that's bringing together like you do as well, just that more holistic approach of when things feel like they're out of our control.
Mm-hmm.
Here are actually some things that really can be in your control to make yourself,
Mm-hmm.
have that better quality of life, like we've said. I'm wondering if you can touch on, I feel like there's a lot of unknowns and fears with hormone therapy slash this idea that it is the must-have way now. So I think there's a lot of women who are on the fence in both directions. Like, do I absolutely need to be doing this? Or if I want a natural route, is that okay? And what fears maybe you can alleviate that might be out there for women on the fence about where to even start with it?
I mean, what I try day and night is to educate women to have that informed decision, to know the facts, and then they decide. Of course, hormone replacement therapy is not for everyone, and this is their choice. But what FDA approved, the recommendations for people who take hormone replacement therapy, one is to prevent osteoporosis. So that almost applies to all of us. So that's the
Hmm.
first thing. So prevention of osteoporosis. The other one is for women who have premature before age of 40 having menopause. That is the recommended. They should go on hormone replacement who is their best interest. And of course, the people with hot flashes and vasomotor symptoms, again, that is recommended to have hormone replacement therapy, but this is not for everyone. And some people decide not. But the fear started many years ago with Women's Health Initiative to 2012, and with this big, huge study that was very biased and misinformation that it caused overnight thousands and thousands of women stop in a fear of having breast cancer, taking hormones. So this was a completely different scenario from what we're doing now. So the hormones, first of all, were synthetic hormones. Estrogen and progesterone, both of them were synthetic. We don't use them any longer, or very rare cases, some of the practitioners may still prescribe. I don't. I always go with bioidentical hormones. And then the average age of these women who were put on hormones were far away. It was like their 60s, 62. That was the average. So we normally start hormone replacement therapy much earlier. And most of these women were smokers. They had cardiovascular disease. So many other issues involved. So I really, with all these studies and reviews nowadays, we think definitely having hormone replacement therapy, or have that discussion with your doctor, it's very important. And then of course, this is personalized medicine. You decide if this is something for you, or you prefer to go natural ways.
That's great. I see a question that came up on it since we are talking on that topic of, you mentioned cancer. This person asked, is it safe for someone to take hormones if they have, in menopause, if they have a family history of breast cancer? How do you kind of counsel and lead people on that?
Yeah, generally speaking, having a family history is not a contraindication of having hormone replacement therapy. But
Okay.
again, it's very, it could be. I mean, it all depends. Some women go through the genetic testing themselves, and that's a different story. But just purely family history of breast cancer is not a contraindications to take hormone.
So, something that's come up, and my understanding on this topic is that measuring hormones in time doesn't really give us an understanding of where we're at. And it's usually kind of based on the symptoms that you're telling your provider. Because some have asked, well, what specific labs should I be asking my PCP or my gynecologist to run? And I'd be curious on your response to that, if I have it accurately, that they just kind of go based on the person in front of them and kind of
Mhm.
understand what hormones they might be needing versus an actual lab test in time.
So um, normally diagnosing perimenopause is a clinical diagnosis. So we go with women's symptoms,
Hmm.
clinical symptoms, as I mentioned, those symptoms before. But and the standard of care, if one goes to their gynecologist or family doctor or endocrinologist, the standard care is not to do serum or blood test. But again, interestingly, I don't want to bring up this discussion, but when a male patient goes and see the doctor for testosterone replacement therapy, or even transgender to have hormone therapy, they will get the serum and blood test. But for women, we hear It's not standard of care. You just start hormone replacement therapy. For me, it's different. My standard of care is to do definitely base serum test, which is normally covered by most insurance, and it's not a big um, burden on people. And that is very important because, again, as I said, I'm not just checking those sex hormones. They could fluctuate up and down, so it's hard to catch them and have the that ideal levels to check an accurate level. But there's so many other things that I want to check and have that base to begin with. And thereafter, once women go on hormone replacement therapy, I will keep checking after 6 to 12 months. So that is important for me. Some of the tests I normally do is thyroid. I want to do the thyroid panel. I want to do lipids. We see a lot of women during this time sudden up with increase in their cholesterol levels. We see, as I said, insulin resistance. So I want to do fasting insulin and A1C. That is very important for me, especially if I want to start hormones on women. And there are other, I do estradiol and progesterone, testosterone. So I'll check those as well. And as well as those, I'm normally doing the urine test to see if women break down their hormones properly. I check their cortisol and other hormone metabolites and process.
Very thorough. I love that. Well, it all works together. It's not just considering the one, like you were, pointing out.
Yes,
It's all of those different processes in our bodies, not
exactly.
just here's
So
some
I want
estrogen.
to make sure everything is good. And if we decide together to start hormone therapy, I want that hormone to go in a healthy body. So if there are other issues, we want to address those as well. That's the beauty of functional medicine.
100%. I wonder if I can ask if we could talk in a little pelvic floor specific topic with
Mm-hmm.
regards to not just stress incontinence, but it came up with a few questions on that urinary tract infection, which can be hypertonic pelvic floor and some difficulty in bladder habits that need to be revised, as well as those hormone changes. So, one that came up was I am on topical estrogen and I'm still having recurrent UTIs. I have a little bit of a response to that on the pelvic floor issue that if we have addressed that hormonal component, I would strongly suggest they consider the role of their pelvic floor in creating that UTI. If we cannot fully relax the pelvic floor to urinate, then we could be retaining some of that urine that's creating that bacteria. And sometimes there is the diagnosis of a UTI with the absence of actual bacterial testing, and that can be symptoms of pelvic floor tension as well. So it's always kind of, needling out that. But what would you say to that person who's already on that? Would you tend to think more of the therapy way, or is there a different hormonal route that you would consider as well in that?
So we see definitely recurrent UTIs and all other urinary, genitally, and symptoms of menopause in women due to vaginal atrophy, the thinning of the wall of vagina, and also the deficiency in lactobacillus,
Mm-hmm.
as well as that drop and fall in acidity of the environment of vagina. So all of those hand in hand could cause, one of them is recurrent UTIs. And if number one, my first option is transvaginal estrogen. Number two, if that didn't help, sometimes I do go with the systemic route of estrogen.
Okay.
That may help with that dryness and cover that symptom. In some cases, we do DHEA, local DHEA. That again, it works beautiful in some women. And that DHEA again converts to little estrogen and testosterone, which is great. And in some cases, testosterone, compounded testosterone, transvaginally, it helps. And then, of course, pelvic floor exercises. That's very important. And the core muscles. I don't know if you add anything else to those to help with that recurrent UTIs.
Yeah, typically it can very often be holding too much tension or poor bladder habits if you're just not completely emptying and then
Mhm,
you're retaining some of that urine, which would be
mhm,
due to poor coordination or that inability to fully lengthen and relax through those
mhm.
habits of tightening. But I'm glad that you mentioned I was unaware of the other options that could treat that if it's not just solely related to that topical estrogen. So if someone has tried that, and it has not been successful,
Mhm.
there are a bunch of other ways to go about
Yeah,
addressing that as well.
I mean, of course, if we think this is due to hormone decline and menopause. I mean, if there are other pathologies, of course, we can't, we have to rule out other issues. We check bladder, do the ultrasound, some other investigations, or bladder studies. So there are other investigations just to make sure we're not missing anything, other diagnosis. But generally, for menopause purposes, these are available treatments that we can use.
Just a lot of tracking down, right? It's
Yeah.
staying on top of it and it's advocating for yourself and it's
Mm-hmm.
finding the right provider, someone like yourself who is going to go through
Yeah,
that troubleshooting,
exactly.
which I think is lacking still these days in
Yes,
accessibility for women, which is the unfortunate part,
exactly.
is getting those roadblocks of
Hmm.
physicians who are not as well trained in it, reasonably so. As
Yeah.
you said, it was not a part of your training
No.
and it needs to be, but it gets tough when you're a female trying to advocate all of these different changes and
Hmm.
you're being told it's normal or, here's estrogen and then like go away. But there's other options out there. It's just finding the right person.
Exactly. Yes. You just have to find someone. And again, getting into menopause clinics sometimes, at least here in Canada, long wait to get to them. So it's hard to find the right person, but I hope that everyone can find and definitely talk to your doctor. That's very important, and listen to these all these talks on social media.
Yeah, thank goodness for social media, for you putting all the information out there so that women can just become aware. And
Exactly.
I'm 38, I'll be 39. So I am just gobbling up all of the information so that I
Hmm.
can be aware through the next 10, 15 years, as all of those things start to change, as well as just for the community that I serve and kind of helping guide them at least even what considerations they can have and who
Hmm.
they should be seeking out to have that complementary effect for their overall wellness.
Yes, absolutely.
Excellent. Well, I really enjoyed chatting with you. I think this is such a necessary conversation, and I think the questions can be endless, but I feel like we did a good job of hitting those high
Mhm.
points on there's some of those things that are hard to hear that it depends on who you are and it takes some troubleshooting, which
Yeah,
nobody wants to
I
hear,
know.
but that there's lots of options out there and
There
it
are lots
takes
of options.
that
Yeah,
total body holistic view of the
absolutely.
person in front of you.
Mhm. Yes. It was lovely
Excellent.
talking to you.
Yeah, I appreciate it so much and we should think about doing it again.
Yes, absolutely.
All right. Well, we will sign off and we can save this
Yes.
to our page for people to check out later.
Yes.
All right.
Great. Thanks, Caroline.
Thanks for your
And
time.
everyone, thanks for being here. Bye-bye.
Bye.
Bye.